Good afternoon, and welcome to HPFY's monthly webinar on all things respiratory. My name is Laura Castricone, and I'm a respiratory therapist. For you guys, just to let you know a couple things, that this is going to be recorded and it'll be on our YouTube channel, so you can view it at your leisure. And at the end of the presentation, we open it up to comments, questions, if you have any. I also am going to give you my email address, so that way if you have anything you would like to comment on or questions you might have for me, it's Laura, L-A-U-R-A, at hpfy.com. Welcome. And today we're going to be talking about how to be good to your lungs. So in case you guys don't know, we'll go back to some things you may have learned in science in high school. Your heart and your lungs are actually partners in crime. Your lungs actually oxygenate your blood. So when your heart is pumping blood through your system, your muscles take up the oxygen and use it. And when it goes on its return trip to the heart, it's unoxygenated, and your lungs put the oxygen back into the blood so it can be delivered back through the system. So if you deprive one system, you also deprive the other. So in other words, if you deprive your heart of care, your lungs will suffer. If you deprive your lungs of care, your heart can also suffer. And low oxygen levels in the blood affects both your heart and lungs, as well as the rest of your body. It can make you tired. It could make you not be able to perform. You certainly can't do exercise if you're not getting enough oxygen. And it can have the reverse effect of making an increase in carbon dioxide is also well in your blood. Things to do that you can possibly do to help your lungs. And one of them, I think this is for exercise. It helps to increase your lung capacity. So like anything else, by doing exercise, and it doesn't have to be very, very exertional, you can increase your lung capacity. It also helps to raise the oxygen levels in your blood, because as you're bringing in more oxygen, it's able to be transferred more easily into the bloodstream. Your lungs are also very elastic and pliable. And if you have any insults to your lungs, that elasticity starts to go away. So by exercising and giving more blood to your system and your lungs and your heart, you're keeping them elastic. Things that you can do to, walking, jumping rope, jogging, and those are very aerobic activities. So they increase your heart rate. And what happens after that is you get more oxygen to your body. Also weight training and core strengthening. Even things like yoga will help to increase the oxygen levels in your blood by doing something above and beyond what you normally do. Obviously, we want you to consult a physician before you embark on any kind of exercise program, because for some people, exercise may not be the right thing for them to be doing. And also, when you exercise, your heart beats and your blood flow becomes more efficient. If you're a person that exercises all the time, you'll notice that your heart rate goes down instead of up. And that's what we'd like to see, the heart rate maintained at a lower level and not beating in the hundreds when you're trying to do these activities, because then that's an exertion on the heart. So these are breathing exercises that you could do. And one of them we call pursed lip breathing. And this is something that even athletes do, and especially weightlifters. And basically is done to increase the oxygen delivery into the lungs. By doing this pursed lip breathing, it helps you to slow down your breathing, and it decreases panting. So when people pant, a lot of times they blow off more carbon dioxide than they need to. And if you pant too much, you can pass out. So panting is not always the best thing for us, but we if you learn how to do a proper breathing exercise, you can get that to slow down. Also, pursed lip breathing creates a back pressure in the airway, and that keeps it from prematurely closing down, especially for people that have lung disease or asthma. What happens with diseases like that is the airway has a tendency to prematurely close down when they go to exhale. So this allows it to stay open a little bit longer. It also helps with endurance during exercise, breathing properly. So here's how we tell people to remember how to pursed lip breathe. Sniff a rose, blow out a candle. By pursing your lips, you're creating a back pressure in the airway. And for people that have any other issues that maybe when they're short of breath, they get a little bit anxious, or if the air is a little bit heavy, they get short of breath and it causes them to be anxious. Pursed lip breathing is also a way of slowing the breathing down, getting it under control, and it's before you start panting and blowing off too much CO2 and end up in a problem. So these are some of the things that we should avoid. Airborne particulate matter. And sometimes we don't even realize they're there. So smoke is a very permeating thing. Obviously, we've gotten to the point where we don't smoke in restaurants anymore, in public places. So that's great for people that are non-smokers. But sometimes it's not as efficient as it should be. The non-smoking area is right next to the smoking area. So you're still breathing in someone else's secondhand smoke. Bonfires. We all like to go out and make bonfires now. We all like to sit around the fire, especially since COVID, it's a nice little thing to do. But anybody that has a problem with breathing, asthma, or it has any problem when the air is heavier, bonfire smoke or any kind of smoke that ends up in the air, like it's the same thing as a forest fire because you're burning wood in your fire pit, and people are breathing that in, and that can be a very, very big irritant for the lungs. The air quality today in Connecticut is very poor because we have humid and hot air, and humidity in the air allows it to be more dense, and it can contain more pollution and particulate matter. So when the air quality is bad on days like today, if you have a problem breathing in this type of air, it's best to stay indoors. And if you have lung disease, it's probably in your best interest to stay indoors. Air conditioning is important because not only does it filter the air inside the room you're in, but it also decreases the humidity, that dense air that makes it hard to breathe. So what the air conditioning does is take the water out of the air. So that way the air is thinner and it's easier to breathe with. Chemicals. Now, we talk about this a lot as respiratory therapists because even though we like perfumes and perfumed products for our hair or to wear perfumes, not everybody can tolerate that. Many doctors' offices that do pulmonary medicine will even say right at the door, please do not wear hairsprays, perfumes, because a lot of their patients, especially patients that have asthma that's triggered by that, can go into a bronchospasm. So we try to tell people to avoid chemicals and aerosols that might trigger any asthmatic symptoms or any kind of shortness of breath or trigger the airway to constrict. I know for me, there used to be a product called Easy Off. I don't even know if they sell anymore, that you spray in your oven to clean it, because now we have self-cleaning ovens. Whatever was in that, and chlorine's another one of mine, triggers my asthma. So you have to be careful. In the summertime, one of the big chemicals is chlorine, because we do a lot of swimming in the pool. And you might notice that you might be a little short of breath or have some heaviness in your chest from breathing the chlorine vapors in. We've all been used to wearing masks, not by choice, but because we were in the middle of COVID. But what that showed us also is that we can prevent a lot of illnesses that are prevalent throughout the year, not just COVID, but the Coxsackie virus, the flu virus, because they're spread by droplets. And so since we got used to wearing masks, it's not a bad thing to wear a dust mask when you're sweeping or painting or doing anything where you might inhale. There's better masks for painting, like your N95s or your respirators. If you're going to be doing aerosolized painting, that's what you want to go for. But a good old standard regular mask, if you're going to be sweeping outside, when you're sweeping, that dust becomes airborne, and in that dust is organic matter that you might breathe in, and you can get infections in your lung, believe it or not, from things that you breathe in just from sweeping. And avoid fumes. A lot of fumes that bother people, gasoline. Some people can't pump gas because the fumes of the gasoline cause their airway to constrict. Other fumes are usually chemicals, like we had talked about, aerosols, things like that. But you should avoid them when possible. And if there's an incident in the area that you're in where there's a fire and there's smoke in the air, you probably should get into your car, put the air conditioning on, or go in your home, put the air conditioning on to filter out some of that smoke, so that way you don't breathe in or any of the fumes that might be there. So drinking fluids is not only so we don't get dehydrated, but we don't want to dehydrate our lungs as well. Your lungs are a very moist area, and that's why it's very easy also to get an infection if something goes wrong. But we want to keep that mucus lining that we have in our lungs hydrated. So you got to drink a lot of water. And some fluids are actually, they rob you of fluids like coffee. And I love coffee, but coffee makes you urinate a lot. So it actually robs your body of fluid. So you want to stick with things that don't make you lose fluid, such as water, because your body uptakes water very easily. Water also helps to regulate your body temperature. The last thing you want to do in weather like this, where it's in the 90s, is not have enough fluids on board and get dehydrated. You could end up with bad muscle cramps, and you can actually pass out from that and end up, in a situation where your body temperature goes up too high and it takes a long time to regulate it back down. We've known this for years when we did people with ventilation or anybody that's been on an open tracheostomy tube. We're bypassing their nose, and your nose is your normal humidifier. So without fluids, if someone's not breathing through their nose, we have to give them some artificial humidification, because patients and anybody, if you can get dried out sputum in their lungs, if it dries out enough, it can block up a portion of the lung. You won't be able to breathe. So you want to be able to make sure you're always hydrated. And not just your lungs, but all your body systems need water or fluid. And even like Gatorade, something like that has electrolytes, that's fine, but we want to avoid too much sugar too. So kind of want to find a balance with that. So reflux is a really big problem that people don't realize. They think it's just having heartburn, but actually reflux can cause a lot more problems than people realize with your breathing. Because your uncontrolled acid reflux can get inhaled into your lungs, and that can cause you to have what we call a pneumonitis or a pneumonia. So the recommendations are, if you have gastroesophageal reflux, which is what GERD stands for, avoid your spicy foods, avoid alcohol, even tobacco and smoking can make that acid worse. Try not to eat before you're ready to go lie down at night, because that can back up, and that's not a good thing. You can inhale food particles, anything like that will cause another pneumonia. If you have the permission of your physician, take medications. There are over-the-counter medications that help turn some of the pumps off in the stomach that control that spew acid into your stomach to solve foods. Sometimes you just have too much acid in there, and some of those they regulate the acids in your stomach. But there are ones that are actually prescribed. So we don't want you taking this stuff because it could interfere with something else that you're taking. So always check with your physician before you even go into the store and ask, especially if you're on multiple medications. And like I said, the reflux gets really aggravated by alcohol, spicy foods. As you know, if you have lots of salsa, you're probably going to have a little bit of heartburn, or anything with tomatoes and stuff like that, those spicy and acidy foods. Aspiration of the stomach acid can cause damage to the airways and the lungs, and also you can get Barrett's esophagus, which is from constant regurgitation of the stomach acids into the esophagus. It ends up causing a lesion in there, which is a precursor to esophageal cancer. So GERD is very important to control. If you have reflux, it can also contribute to obstructive sleep apnea. People don't realize that they're kind of, they go hand in hand, because if your reflux is not controlled, it'll keep waking you up at night because you're inhaling that stuff. And like I said, if the acid gets into the lungs, you can get a pneumonia very easily, and that's not a pleasant thing. You may even be hospitalized depending on how bad the pneumonia is. So a big thing is to listen to your body. If your body says, not today, as far as exercising or doing something that you don't normally do, don't do it. And before we just start, like I said, always check with your healthcare provider before you do anything exertional or any kind of exercise regimen, because we don't know. I don't know personally what your case is or what your history is, and it may not be the most judicious thing for you to be doing. If you're on prescribed medications, don't be dabbling with, oh, maybe if I don't take this today, I'll feel better. There's a reason why you're on prescribed medications. There's a reason why you're on certain dosages. Without consulting with a physician or the pharmacist, I would never change your regimen of your medications. A lot of those keep your lungs open, like bronchodilators. Some people are taking steroids, and you need those. So don't, and steroids are funny. You can't just stop them. They affect your adrenal glands, so you have to taper them. So make sure you understand the medications that you're taking and how to take them. You know, I'm in my 60s now. I can't go at the pace I used to in my 20s. So remember who you are and where you are in life. And if you are an avid exerciser, you probably can do a lot more things in your 60s and 70s and 80s. But if you're not, and you're just embarking on an exercise regimen, just because your friend can walk 5 miles a day doesn't mean that you may be able to do that. Go at your pace and rest when you're tired. Take a break. I always tell patients that have lung disease, climbing the stairs or doing anything exertional can fatigue them very quickly. So a lot of times we'll tell them that's when you should be doing your pursed lip breathing. If you're short of breath and you use a nebulizer or an inhaler, use it. Use it as prescribed by your physician. If you're overutilizing, if you find that you need to use it more than you've been prescribed, then you need to call your physician and have a little powwow with him or her and find out why you need your inhaler more frequently. It could be the beginning of maybe a viral or a bacterial infection coming on. Something may have changed, but it's a good reason to give a call to your doc. If you don't feel well, call your physician. Don't keep waiting, especially now with COVID around. People that have lung disease, they're at higher risk. And people that have diabetes, you're at higher risk. And people that have obstructive sleep apnea, you're at higher risk usually because of the obesity that's involved with a lot of people that have OSA. So if you don't feel well, don't try to guess what it is. Call your physician, explain your symptoms, and see if you can get some treatment. Remember, there are very few treatments for viruses. When we get antibiotics, they're for bacterial infections. So taking an antibiotic when you have a viral infection is not going to work. So if your doctor says no, antibiotics aren't warranted, then you have to listen to them and don't beg for your antibiotics. As a matter of fact, we're getting to the point where we're becoming resistant to most of the antibiotics that we have available to kill a lot of these bacterial infections. It's becoming very critical that we don't overutilize them when they're not indicated. Slow down. As we age, especially, we don't move as efficiently, and you can break something like I just recently did. So slow down, know your environment. If you're walking on uneven terrain and you're afraid you're going to fall, be careful and take your time doing things. Eating well. Your body is a machine that requires fuel as well, just like a car. So, but we, in this society, we eat very poorly. We eat a lot of carbohydrates, we eat a lot of sugar, we eat a lot of salt. So to really get the most benefit from your diet, if you can, it's best to eat a diet rich in antioxidants, protein, and complex carbohydrates. Some of the fad diets, they work in the short term, but to sustain a keto diet for the rest of your life is probably going to be impossible. And your body does need some carbohydrates to perform, and it can't live on just one substance alone, like just carbs or just protein. So you have to have a balanced diet. Try to avoid our refined sugars that we get from snacks that we love. They make them purposely that way. It's almost like a drug. We like fats. We like the way they feel in our mouth, foods that are dense in fat. So, and alcohol is another thing that's very detrimental to our health, but in moderation, obviously, it's okay. If you're obese or overweight, try to reduce your weight if you can. And that's an easy thing to say because I've always struggled with my weight going up and down. Being overweight not only puts a strain on your joints of your body. So if you're having back issues, leg issues, hip issues, the weight certainly isn't helping. But we also know that extra weight puts a lot of strain on your diaphragm, which is the muscle under your lungs that it pulls down to let your lungs get air in, and it pushes up to release the air, the carbon dioxide and the air back out. And if you're obese and you have a strain on there, you can't breathe efficiently. And a lot of times people will have carbon dioxide retention because they can't get rid of it, because they can't exhale fully, because they have too much strain on their diaphragm. Don't try not to skip meals. If you feel that you want to cut down, maybe try small meals, 6 small notches during the day instead of 3 large meals. When you eat a large meal, it also puts a lot of strain on your belly, which pushes on your diaphragm, and it makes it harder to breathe. And that's why a lot of times people will want to sit back and they're a little bit short of breath and uncomfortable. They've just ate too much and it's pushing on the diaphragm. So try not to do that. If you have to, like I said, smaller meals more often during the day. And breathing does use energy. And for our patients that have lung disease, if you ever saw somebody that has severe lung disease, you'll notice in their area up here in the collarbone, they'll have cavitations where it's so deep because they've wasted all the muscle from just breathing. So when you have lung disease and your diaphragm isn't performing properly, you start using all the muscles in your neck and all the muscles that surround your rib cage to help pull the lungs up and down so you can breathe properly. And that uses a lot of energy. So when someone has lung disease, they really have to pace themselves and keep hydrated and have a lot of good nutrition because they're using a lot of energy just to breathe. Oh, so we're at the end and we're glad that you joined us. Does anybody have any questions? Do we have anybody in the queue that might have a question? Remember, I had given you my email address. Again, I'll give it to you and it's right there on the screen, laura@hpfy.com. And you could let me know if you don't want to discuss it here and you have a question you want to ask me. Feel free. Will answer you back as best I can. Just remember this time of year, we're going into a new season. Fall will be here before you know it. And in fall, we have a lot of molds in the air because of the leaves down and stuff. So we have a whole different problem come fall. So get ready to make sure you maintain your environment so that way you can breathe well. And if you're having difficulty and it doesn't go away, you need to speak to your physician to find out what actually might be going on and get treatment for it. Some treatments are very easy, so it may be something simple to fix. Well, thank you as always for joining us. We look forward to seeing you next month. Have a great month of September, which will be right around the corner, and we'll see you soon. Thanks for joining us.